Sorry, Paul, I don't mean to interrupt you, but it is 5:01, and we are going to go ahead and get started, okay?
Sure.
So everybody, welcome. This is the final budget meeting for the county hospital district. And this first meeting is strictly about the budget. And then we will close this meeting, and then we will open the next meeting for our regular monthly meeting. So, but first, I would like to invite George Pellington from First Methodist Church to give us the invocation. Welcome, George.
Thank you. Thank you very much. Let's pray. Heavenly Father, we come to you today asking for your guidance, your wisdom, and your support. Empower this board to engage in meaningful discussion to establish plans and directions that promote the health and welfare of our community. Lord, fill each member with your grace. Bless them with your insight and your spirit of peace. And Father, continue to remind each of us that all that we do here today and all that we accomplish is for your glory and for the service and benefit of our friends and neighbors. So we pray all these things in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen. Thank you.
Thank you.
Do the Pledge of Allegiance. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll turn this over to Michael Kent, our treasurer. Michael?
Thank you, Madam Chair. We will review, as the agenda says, the September 6th budget, which was approved for fiscal year 23-24, along with our tentative budget. The first item under here is to discuss the percentage increase in millage rate over the rollback rate. On September 6, 23, the Hospital District Trustees adopted a proposed budget for fiscal year 23-24, which included a proposed millage rate increase of 10.73% when calculated as a percentage of the rolled back rate. At that same meeting, the trustees chose to not increase this year's current ad valorem tax of 0.511 mils. This proposed tax rate equates to an ad valorem tax revenue of $13,572,000. Try that again, $13,572,748 for next fiscal year. That will be an increase in the ad valorem tax revenue of $1,618,601 from this fiscal year. Second bullet item is to discuss the purposes for which ad valorem tax revenues are increasing. And as I said, the ad valorem tax rate is not being increased. The increase in tax revenue is due to the assessed property tax values in Indian River County that have increased over 12% this past year. The hospital district is also carrying forward just over $9 million in cash, and the reserves and investments are increasing by $925,000. In this budget, there's an increase of $3,290,533 in program expenses over the current budget year, and an increase in administrative expenses of $69,500. Inflation has had an impact, obviously, on all of the organizations that the district funds, also has had an impact on the administration of the district. Additionally, the district is adding 6 new organizations and 9 new programs to this year's proposed budget. And in responding to all of these needs, we are utilizing cash brought forward and the increase in property tax values to hold our ad valorem millage rate level to this year. The third item under number 4 is to listen to public comments and to field questions from the public. So at this point, we'll ask if anyone would like to address us, has questions or comments. See no one rising. Oh, do we have anybody on?
Anything on Zoom?
Okay. We will move to number 4, which we can ignore. It's making changes to the items. If there were any action based on comments in number 3. And I do not have to do number 5, which is to sit here and quickly try to recalculate all of the things. I brought the computer, but I appreciate the fact we don't have to do that. Which takes us to number 5 on the agenda, which is the adoption of the fiscal year 23-24 budget. Number 1, and you have in your packet 2 resolutions. The first resolution, 2023-03, is the item that will adopt the millage rate, which again we have established to be 0.5110. We have a motion. Do I have a second?
I'll second.
Trustees, is there any comments from anybody else? Not on Zoom. Public comments. In that case, let's call the question. All those in favor, please say aye. Aye.
Aye.
Aye.
Were there any noes? Okay, the millage rate has been established. Number 2 here, it's the second resolution that you have. Resolution 2023-04 is the document that actually sets the budget. But I have a few comments that I want to make that just clarify. Before I call for action on the budget resolution, I want to point out, particularly to the trustees, that there is a slight deviation in the proposed budget that's attached to the resolution presented tonight from what you approved on September 6th. The changes were made when the district received our financial statement through August. With our 11-month financials in hand, I met with Frank and with Kate, and we more accurately annualized the current year expenses for both program and administrative costs. And again, those changes are in that 4th column, which is the fiscal year 22-23 projected costs. Specific to fiscal year 23-24, which is the budget that we are about to approve, I presume, there were 2 changes made. Because of the changes we made in the projected costs for this year, the cash balance brought forward modified. It was reduced by $206,202. The number it was reduced to, as you'll see, is $9,077,780. Second, the reserve fund health care contingency was reduced by that same amount to $1,290,979. Those changes did not alter the millage rate, the increase over the rolled back rate, the ad valorem tax rate that was approved at the September 6th meeting, or the tax revenue. With those comments, at this time I ask for a motion to adopt Resolution 2023-04, which adopts the budget of $13,572,748.
So moved.
We
Second.
have a motion and a second. Trustees, any comments?
My only comment would be to thank Michael for clarifying the fact that the budget did not increase in the newspaper. The suggestion was that it did, but you made a nice clarification, and I think that's important to note for the record.
Any other comments? Any comments from the public? Hearing none, let's call the question. All in favor of accepting the resolution and next year's budget, please say aye. Aye.
Aye.
Aye.
Any nays? Hearing none, that is approved. The last item is to announce publicly the millage rate as a percentage of the rolled back rate. As I said before, the millage rate as a percentage of that rolled back rate for fiscal year 23-24 is an increase of 10.73%. And with that, I am done.
Thank you. Any public comment at that? Hearing none, we will adjourn the meeting for the final budget hearing for the hospital district for 23-24. Thank you, Michael, for all the good work. This is a challenge for your first year in. You did great. Okay, we will now start the meeting of the regular monthly meeting of the Indian River County Hospital District. And I would like a motion for approval of the budget discussion meeting minutes dated July 11th, the chairman's meeting minutes dated July 19th and August 16th, the regular monthly meeting minutes dated July 20th, the special meeting minutes dated July 28th, and August disbursement of,
946,096,000, wrong. $946,096.80.
and a September disbursement of,
$1,015,640.40.
that's why I let you do that. Okay, may I hear a motion?
Move approval? Second.
Okay, all in favor?
Aye.
Thank you very much.
Aye.
Okay.
Aye.
I just would like to thank all of the trustees, the process, and particularly our new trustees going through the budget process this year. It's always an interesting process for us. And somehow we make it through and come to an agreement. So I think it's really good. And I think it's very exciting that we have new organizations and new programs that we're supporting and feel good about. So I think that's very good. And welcome to Frank. Glad to have you here. And we're happy to have you here. So Jennifer.
Okay, thank you. See if I got this here. I've responded to questions of those of you that have had questions for me this month, as I always do, and continue to review our annual deadlines and deliverables due under the lease with the hospital, and have responded to questions there in that regard as well. A lot of the time this month, we've just been working with the VNA and their council to evaluate the appraisal that they obtained, as well as the appraisal that the district obtained on the hospice house parcel. We did have some good discussion about this at our chairman's meeting yesterday, and decided that it was reasonable to meet in the middle, subject to the VNA board approval. The district has approved selling the property for a purchase price of $3.8 million to the VNA, and so we will be working with their council this coming month to get a contract in place for the board's approval and execution to then set forward a time period for closing on that property. We're still also working to determine what the district would like to do with the Human Services building, since the VNA did vacate that several months ago as well as a tenant. We're still evaluating that matter and had some good discussion on that as well yesterday. And then, of course, we've welcomed our new executive director this past month, and so I've been working alongside him and the staff to help him acclimate to his new role and provide guidance and helpful information when I can be of service. So looking forward to a continued productive relationship there and benefiting the district and the taxpayers of Indian River County in that regard. And also looking forward to this budget cycle coming to a close and going into our coming fiscal year. Any questions for me at this time?
I think just a point of clarification on the HSB building. I mean, I do believe that what we did was set a direction
That's true.
yesterday and to work with VCOM, which is Edward Via School of Medicine, School of Osteopathy, and to be able to bring a School of Medicine here into Indian River County and Vero Beach. So I think that's very exciting for everybody. We have a lot of things to work out relative to that. And also looking at Dr. Cooney's proposal of putting a clinic as well in the front, or the first floor of that. So there's a lot to work out yet, but we do have that direction. We do have agreement on that direction, and so I think that that's very exciting.
Yes, thank you for clarifying that. That was just discussed yesterday at our chairman's meeting, and when I submitted this report, we didn't have that information. Thank you for filling that in.
For our financial review, Michael.
Through 11 months of our fiscal year, we're fortunate that the financials continue to show that the hospital district is in excellent financial condition. In August, we received a whopping $42 in ad valorem tax revenue. That brings our tax revenue, though, to 99.97% of the budgeted amount, net of commissions and uncollectible taxes. That equals actually 99.37%. But we may even get another $42 in the final month here, who knows. As Frank's report notes, overall program expenses for the month were $111,520 under budget, and administrative expenses were $21,608 under budget. It also shows that our total investments at Deep Blue are $4.6 million, and additionally, we hold about $3.1 million with Treasury Direct T-bills. Also, within the last couple of weeks, or a week, it goes by so quickly, there was a $1.25 million T-bill that matured. Frank conferred with me, and we agreed to cash it in as our operating account needed some additional funds for all of the month's disbursements. I believe $600,000 was transferred into our operating account, and the remainder of that cash T-bill is now in our U.S. Bank custodial account. And the long and the short of it is that concludes my report.
Do you have a feel, maybe you don't, of what interest we have made off of those, by chance?
There is a comment about the monthly, I don't know if it's,
Interest,
Yeah, we have that number. I don't have it
says
handy.
interest from the,
that's just what I was looking for.
at the very third paragraph.
Yeah, the preferred deposit pool, and that's not doesn't include the T-bills,
Doesn't include the,
was $10,000 for the month and $127 for the year. One of the things that we were talking about when I met with Frank and we were looking at the budget and everything else, which is the fact with the new Finance and Audit Committee with Frank, one of the things I think we'll do is, and perhaps the trustees would like in as well, we want to have a meeting with them and kind of review, get reestablished with how things are operating and what dollars are where, what kind of interest rates are we getting, what kind of procedures and policies are in place or need to be in place. So that will be happening in the relatively near future.
yeah, I just asked, because,
No, it's a
you know,
fair
this
question.
is fairly new to us, that we're investing in.
But they've been significant.
Yeah,
I've referred a couple of times to when we rolled things into that PDF, that's making over 5%.
that's great,
You know, so I mean, it's been a good return.
it's good. Frank, your first report.
Thanks, Mary Beth. So, going to keep this brief. Just to start with a couple follow-up items. The Independent Special Hospital District Performance Review. This is something that we continue to make progress towards this review, as it's something that we have to complete every 5 years as part of the Uniform Special District Accountability Act. So we're working with a consultant partner right now, BJM CPA, and I'll be finalizing these items, working with Kate to complete this submission. And again, this is something we need to complete every 5 years.
Is that something that we, the trustees, should review before it gets turned in, or?
I don't know the answer to that yet. We're going to have a call this week. So let me speak with Dave. BJM, please.
Sorry. Right now, we're just in the beginning stages of giving them the documentation. The report is nowhere near complete.
Correct.
So basically, they've given us a list of items that need to be presented to them. I've done, I think, about 90%. There's some things that I'd like to talk through with Frank and Jenny, so we have a meeting coming up, and then we're also going to meet with BJM and have an introduction with Frank. Once that happens, we'll be able to provide you with an update, but of course, you'll be able to see their work product once it is developed, but that, we're not there yet.
Right, and thank
I
you.
just don't want any surprises for
No,
here.
yeah,
No,
for
there
sure.
won't be any.
Yeah.
Yeah, right now, it's just in data collection. So Kate has uploaded a lot of the information that they requested, just due diligence, collecting everything. And then once we start to move in that direction, closer to a report. But yeah, of course, the trustees will be involved.
And
sec-
this is excuse me, sorry. On the audit, it's statutorily mandated, right?
Correct.
And Jennifer, that may be Peshke, that may be a question that you can field for us as well as for the integrity of the report process for us, how engaged we can be. In other words, my understanding of the process is we're engaging them to do an objective audit of us for state oversight purposes. So there may be some limitation in how we participate in the process other than providing the information. So that just may be something that Shini should look into for us before we have an oops.
I agree. I'll take a look at that, on that end of it as well, and I'll coordinate with Kate and Frank on that.
Just for the record, it's Florida statute section 189.0695.
Thank you.
Thank you.
A second update, Gifford Health Center. So we had some issues with a corner of the building at the Gifford Health Center. We had engaged T.E. Schlitt Engineering to determine the significance and the extent of the defects in the structure, to make sure it was safe, to see what we would have to do to remediate it. At this point, we did get a recommendation to stabilize the foundation, and there's a process for that. So at this point, I recommend that as soon as possible, we get some bids on it from contractors and get that work resolved. That's some follow-up items, and I just want to mention a couple new items. It's been super being in the community, met a lot of great people. It's been absolutely wonderful. Had the pleasure to get out and talk to everyone at our funded agencies and see all the good work that's happening, and it's been really fantastic. One of the things to emphasize was how the district's support has really made a difference and impacted lives of those they serve. So it was really great to hear that. So I really appreciate all the hospitality from the trustees, from our funded agencies, and also from the community. It's really been fantastic. It's really been a warm welcome, warmer than I've ever received in a community. So I'm very grateful for that. So thank you. A couple other things. So Cleveland Clinic, this is important to me. I spent several years in hospital operations, and spending time with some of the folks there, especially Dr. Peter, it's very important that we continue to build and strengthen that relationship. It's so important to our community. So I'm going to continue to do that. Just to follow up a little bit more on VCOM and our discussion on bringing the medical school here, this could be a fantastic opportunity to ensure we have a long-term supply of primary care docs serving our needs in the county for decades to come. But as Mary Beth pointed out, there's a lot of details that we have to work through, including Dr. Cooney's proposal, talking about how, if there's any way we can integrate some primary care as part of the residency training program and actually deliver some services on the first floor, logistics, operational oversight, that sort of thing. So we're gonna move forward with that discussion. I still have to set up a meeting on that, and I'll keep everyone updated. And just the last thing I wanted to mention is most of our folks in the community know about the UF Psychiatry and Addiction Medicine moving out of our area here. So they're closing at the end of 2023. We're working with West Salmons and all our local agencies to ensure that we have continuity of care for about 2,600 patients who are going to need this care. And it's very important that when patients are displaced from care, doctor's office closing, services transitioning out of the area, that we have a plan and that we take a leadership role in making sure that we coordinate with our agencies and all the patients receive continuity of care. So we're meeting on October 3rd to just address this swiftly, and it's time sensitive, critically important. We all know that.
I would just add that along with the patients and making sure they have the care, that we don't lose staff.
Indeed.
It's very important that they stay here in Indian River County.
So
That's got to be as much
agreed.
focus.
So that
I have a question If I might, I have a question regarding that.
Go
Bill
ahead.
Cooney.
Cooney.
In the past, when physicians have retired or left practice, they've written letters of, and in the press, as well as made an effort to find a person, as you've already discussed, a doctor, a psychiatrist, or psychologist to continue on the practice. Did any of that occur? Is the public aware of what's happening here, or where are we at from a general knowledge standpoint? Or is this too new to really know?
Well, that was prior to me, so I can't speak to the detail on that.
Okay.
I can answer just that they
Get
have.
up near, get near a,
Okay.
It's on.
They have been notifying their patients currently, and like I said at yesterday's meeting, Wes is providing UF with a complete list of all the providers in our area, what services they can provide to their patients. We're going to meet so that we can talk about the transfer of medical records and those type of issues as well. But yes, a letter, I don't know if a letter's gone out yet, but that's what they're working on, but they are notifying their patients.
Well, very good. As I think as Mary Beth mentioned, we really don't want them falling through the cracks, which tends to occur. Thank you.
That concludes my report. Thank you.
thank you. We'll move on to our funded agencies, so we've got Cleveland Clinic first.
Good evening. Just want to start out by announcing some of the leaderships we had for our intensive outpatient program. For those that you aren't aware, Carissa Bolden transitioned out to become the director at Pace Center for Girls. And we now have Kelly Williams, who was one of our IOP therapists, received a promotion and is now the outpatient clinical manager.
Great, congratulations.
Thank you. So, to start off, what the IOP team has learned in the last 6 months that was not expected, but has been reinforced. We opened our adult track originally, which we were planning to have patients ages 18 to 24. We were very confident with the amount of increased admissions we had through the inpatient program that we would be able to keep the program, the referrals coming from inpatient. But what we quickly learned is that age group either had a lot of family responsibilities and job responsibilities that wouldn't let them meet the IOP commitment of 9 hours a week, the individual therapy, family therapy, and psych, or their mental health needs were so great that they weren't able to sit in an IOP group. So after reviewing additional things, we determined that we would expand the adult IOP groups from ages 18 to 24 just to the adult population. And since then, we've consistently received referrals and the program has been flourishing. In addition to the adults that were not ready for the IOP group, because we didn't want to just discount the 18 to 24, we began those patients in individual therapy and psychiatric treatment, whether it be through our Cleveland Clinic psychiatrist or a community provider. And then once they were more stabilized, they've been able to transition into the IOP groups. And with that, I'd like for Kelly to give us an example.
So I wanted to share a success story. I think it's important for us to know that there are people behind the numbers that we serve. And so I wanted to share a story of a 13-year-old who came to us last spring, so spring of 2022, and she had experienced 3 hospitalizations in 6 months prior to her being referred to our program. She attended our groups for 7 weeks, but unfortunately her mental health symptoms required an additional hospitalization, and she was eventually transferred to residential care for about 6 months of a period of time. She had discharged from that program and had been participating in a PHP program, so partial hospitalization, and this past spring she was re-referred back to our program. And one of the things that she said upon intake was, "I didn't get to finish the program. I want to finish it this time." And so it was really neat to be able to see her change in comparing her to spring of 2022 and spring of 2023 with a renewed perspective, with being able to apply her coping skills on a regular basis, being able to improve her communication with her family, her family becoming more involved in her care. And so she participated in the full 12 weeks of our program. She graduated, and we always like to do a feedback scale for all of our patients. And so I just wanted to read what she said. "This program has truly saved my life. I've learned so much from this program, including that I can be the best version of myself. This has helped me turn my life around." One of the things that we also do after discharge is that we do follow-up calls 7 days, 30 days, and 90 days post-discharge to ask and inquire with the patients and their families how things are going: school attendance, stability, rehospitalization. And so she came to us with 3 prior hospitalizations, and since discharge after 90 days, she has not been rehospitalized into any program and continues to flourish in outpatient care. So I just wanted to share that story.
Awesome.
Without the support of the hospital district, we wouldn't be able to share those stories with you guys today, so we really, really, really appreciate it. Some of the emerging issues that we're seeing throughout the healthcare sector, not only here at Cleveland Clinic, but throughout the state of Florida, is the amount of patients that are arriving in the emergency department seeking substance abuse services. You know, as we've all talked about, the need for a detox facility, as well as a stepping stone between detox and long-term housing. Currently, we're working with multiple partners here in the community to develop a plan for that moving forward, and Cleveland Clinic is committed to being part of that. Over the next 5 years, we see Cleveland Clinic being a huge part of the substance abuse services here in Indian River County, as well as expanding the mental health services here in Indian River. We're working with Carrie on improving our utilization of the substance abuse peers through the emergency department. Several years ago, when Ann was there, they had started a policy and a program, and then I just think through transitions, it kind of fell to the side. So we're meeting and bringing that back so these patients receive the services. So that's the IOP program. Are there any other questions regarding that?
The fact that you follow up for 90 days is magnificent, and it's asking a lot, but if there's any possibility that that could be extended, you know, that longitudinal kind of data is so important so often, and we just don't have it. I simply ask you, I guess, to give that consideration and see if it's possible at 6 months.
Yeah, so
Where are they?
currently, where I used to work, we would do the 7, 14, 30, 90, and 180. So we're on the 180 days, and eventually I'd like to move to 365 because that data is so important.
Thank you.
Thank you.
That's a good suggestion.
Are you full in the IOP now?
The adults, we are very close. We've got about 3 spots, and the children's, we have 8 currently. We've seen a dip since school started with referrals.
Are you getting adults of all ages?
We
Yes.
are. I would say that right now in group, our youngest is 19, and our most mature client, I would say, is about 55.
Okay.
So it's been actually a really neat opportunity to see those 2 age ranges work together in an experience. You know, we had thought, well, the young adults would have camaraderie and they would have similar life experiences, and it's actually been really nice to see the engagement, the support, the accountability that is offered with adults of all ranges.
Interesting. Lesson learned.
Right?
Okay, as it relates to the behavioral health emergency department integration, over the last 6 months, what we've learned is we are very surprised by the amount of support that we have received, not only from our own emergency department, but law enforcement from our county and other counties, as well as other hospitals reaching out, wanting to know how do they start this program in their area. It has exploded so much at any given time. Our crisis specialists could have 5 referrals sitting there just in our hospital alone to go and either assess the patient for crisis needs or provide resources, or to help the staff members know how to communicate with the patient, you know, depending on their diagnosis. It's so nice to see, especially over the last couple of years, where maybe we didn't communicate as well as we should have with law enforcement. Now, when law enforcement's arriving to our emergency department, they're asking, hey, is the crisis specialist here on shift? Can we get them connected to the patient? So most often, we don't have to wait for the registration to put their information in for the crisis specialist to already know to go see the patient and begin assessing them. So that's been very remarkable. Some of the things that we didn't, oh,
The
I'm sorry.
IOP patients all Indian River County residents, or are there times that you get them from?
So I think they're all currently Indian River County residents. I think we've had 2 since the inception that we reached out because it was somebody from another community that was willing to pay to bring their child back and forth through to the program. Yeah. So what we didn't expect to happen is when the behavioral health patient arrived to the ER, they were going to see the psychiatrist, they were going to see the medical doctor, and then they were going to see the crisis specialist. That we have noticed can be a bit overwhelming to the behavioral health patient, as well as extending their time in the ER. So we're transitioning October 1st, where the patient will see the medical doctor and the crisis specialist. If necessary, they have access to the telepsychiatrist, but if they're admitted to the behavioral health center, they're going to see a psychiatrist within 24 hours already. So this gives us the ability to facilitate them very quickly to the inpatient center without having to wait for that telepsychiatrist to come on the screen. Currently, right now, we are wrapping up the finishing touches to the behavioral health zone in the ED. They put the desk in today, so I'm hoping by next week we'll be moved in and begin utilizing it. So that's going to be a 6-bay area for our behavioral health patients that will have the medical nurse, a behavioral health nurse, a medical provider will be coming through, psychiatrist if needed, a behavioral health tech will be in that area, as well as a safety officer will be coming through. And then just in addition to the VCOM med students, I just wanted you guys to know that we were just approved and began accepting mental health counseling interns and social work interns for Cleveland Clinic. So that has been a big project and we're excited about that. We have current contracts with Berry University and Nova University. So as we expand those, we'll expand to additional areas. And then the last thing I wanted to do is just clarify during a recent meeting that we had, there was some discussion about a 46-bed facility in Weston that belonged to Cleveland Clinic. I just wanted to clarify, that's us here in Vero Beach at the Behavioral Health Center. So just if anybody had any questions about that.
The clarity on that is that Vero Beach is going to be the center, right? For
Correct.
Cleveland Clinic, Florida, for behavioral health.
Correct.
And that, I mean, that's good for us.
Yes.
That's huge.
Yep.
And a lot of that's because of the work you ladies do, so thank you.
Thank
for that.
you. We appreciate y'all's support.
Absolutely. I'm hopeful that when we get interns, that they will stay in our area.
Yes.
To become providers who are licensed, so that the needs of our mental health community are able to be addressed.
Treat them well.
We will, we promise.
We will do our best.
All right, any other questions?
Thank you.
No, thank you guys, we appreciate y'all.
Thank you very much.
Tykes and Teens, Ann. You brought a whole group with you.
I did, and I'll introduce them. My peeps, as I said. But before I do that, I just want to say how stinking proud I am of everything that Cleveland has done in behavioral health, because those were a long time coming. Y'all have done a fantastic job.
That's what I said, we're all Ann's group.
So I'm Ann Posey. I'm the Chief Executive Officer for Tykes and Teens, and I did bring some people with me. So Linda Kloss is the president of our board of directors. She also happens to be an Indian River County resident, so we're very proud of that. Ken Jenson is our director of grants and contracts, so she keeps us solid as far as making sure that all our finances are good with our grants. And then Elizabeth Applegate, who does our mental health consultation program. So if there are any questions I can't answer, they're available to do that. So first of all, I want to thank the hospital district and the trustees for your generous funding of Tykes and Teens. This funding has allowed us to open a physical office in Indian River County and bring the services that we've provided in Martin, St. Lucie, and Okeechobee into Indian River County. So we now have a fully functioning outpatient office in the 787 building, right there with Treasure Coast Community Health and a couple of other things that allow us to offer our youth access to those mental health services. It's also allowed us to have our mental health consultation program, which Elizabeth runs and oversees, and ensure that the early learning child care centers are equipped to provide for those social emotional needs of the children that they serve. So we're very thankful that you all have funded us and allowed us to come into the county and provide those services. So the two learnings in the last 6 months, you know, we continue to be profoundly impacted by the rise in suicide, which has been more evident recently in our county. This reinforces our mission that we need to intervene early and have ease of access for our children and families and provide them access to affordable evidence-based mental health care. So that has been reinforced to us. We've also been paying very close attention to the need for parent support. So when you treat children, you do treat the family and you treat the parent, but I always go back to when my daughter was struggling, you know, and I happened to have some friends that I could call who'd kind of been through it, you know, who could talk with me about what to do or what I was feeling. So we're really looking at parent peer support as a possible program to bring to this community. It's, I think, needed in all our communities. And it pairs a parent with another parent with lived experience, not a professional, but someone with lived experience who can help them walk that journey while they're dealing with their child's mental health. As far as what hasn't gone as planned, so we have a fully functioning office and full range of services for the youth in Indian River County. We continue to try and expand our offerings. We now have a trauma-informed care specialist through some funding that United Way had available to provide trauma-informed care to the community. We are working diligently to ensure that we're fiscally sound and can continue to provide services to the youth for a long period of time, but I think we're still the little engine that could. So I don't think we're as well known in Indian River County as I had hoped we would be by this time, and we continue to work on strategies to ensure that we're known, that people know how to refer to us, that's seamless, and that we can get children access to, because I know they're out there, and I know that we need to provide services to them. Emerging issues locally or in the healthcare sector, I still think navigating, and I think most of you would agree that navigating behavioral health care is clunky at best. You know, access is limited. It is hard to get in. We're very lucky in this community to have the McCabe Connection Center where people have kind of a centralized place to go. But I think we could probably go further. I believe there are people sitting on wait lists at one agency when other agencies may have vacancies because we don't have any kind of centralized type of referral process. And I would love to see us as a community move towards that. I also think it's not really an emerging issue, but the behavioral healthcare workforce, we continue to struggle. There's quite the shortage in the workforce, and our recruiting is impacted, especially in the nonprofit sector, by lower salaries and the higher costs of living. We're all aware that the housing market, homeowner insurance premiums, and generally high costs of living impact our ability to recruit and retain qualified candidates. We also are a training facility. We actually grew our own infant mental health specialist for Indian River County who was a student and is now a registered intern with us. And we're gonna have to continue to work on those strategies, but even that, it remains very challenging, especially for smaller not-for-profits. Parity continues to be an issue, especially in behavioral health care with reimbursement. According to Mental Health Care America, children's mental health visits are almost 1,000 times more likely to be out of network, than physical health visits. That then increases the cost to the patient, a cost to the agency. In addition, increasing administrative costs to agencies that are not reimbursable but are required both by grants and by insurance companies you know, the administrate the data and all the different things that we need to report, and we need to do that. I mean, we want to be good stewards of our finances. But nonprofits are operating at such narrow margins that we're in danger of becoming extinct and not being able to manage that because of those high administrative costs. So I think those are issues we need to pay attention to. And then what have I, as CEO in partnership with our board, think will be most strikingly different about our organization? So I think we'll be a more informed and efficient organization. We'll be able to make better decisions about community needs and how we can impact those needs. And there will be a strong presence in Indian River County and known for the quality of care we provide. So I want to thank you for your continued support of Tyson Teens and our mission to ensure that youth have access to mental health services. And we're glad to take any questions.
I want to thank you, though, Ann. You know, Tyson Teens really didn't have a reputation here, and the reputation it did have wasn't always real positive. And you have turned that around dramatically, and, you know, for the sake of the kids here in this county. And that's a huge, I mean, I'll support you all day long for doing that, so.
Thank you. It's a team effort.
And all of you
though.
that work. I mean,
Team effort.
thank you. Because we need Tyson, we need all of you here doing this work for us.
Thank you.
I've got a question, Ann, I've got a question for you. I read an article this morning, I had mentioned it to Carrie earlier at a meeting, about a national rise in suicide for young, 9, 10, very young
9 to
children.
13. Yep, 9 to 13.
Are we seeing that in our county?
I'd have to look at the statistics, but we generally, actually, in our suicide rate, fall a little higher than the national average. So if you look at the data, and in Florida, I can't specifically say if we are. I'd have to look, and I can get back with you. But we know it's an issue, you know. And when we talk about, so what we count are people who die by suicide. When you start to look at the people who attempt suicide, you know, it's a much bigger problem, and our youth are struggling. I know no one wants to talk about the pandemic, but still, coming out of this pandemic and the issues that impacted the youth and the issues that impact their families, the polarization politically that we see, you know, the difficulties that kids experience, you know, it's no surprise that those rates have risen and probably will continue to rise until we need to intervene so much earlier than we do. We're a reactive society. We wait till we see there's a problem, and we know there's a problem, right? We already know that our kids have faced traumatic, you know, trauma from the pandemic. We need to be intervening, you know, at 4 and 5 and 6 in the child care centers. So that we prevent these issues from happening.
I guess I was most surprised about the age, 9, 10.
Actually, the American Pediatric Society, I believe, has said that the youth mental health is a national emergency.
Thank you.
You referenced one thing that made me wonder if NAMI is still engaged when you referenced the parent and peers. I know that organization kind of stepped back a few years ago, but I didn't think that they necessarily dissolved. I don't know if you know.
I do. I know a little bit. So NAMI has not dissolved, although I don't believe they have a strong presence or group in Indian River County. There is, in Martin County, there is a NAMI. NAMI is the National Alliance for the Mentally Ill.
Right.
Tends to be parents of people with severe persistent mental illness. So, and a lot of those are parents of adults that they're dealing with. They do a program that's really great, and I would love if we start doing parent peer support to work with NAMI, because they already have an established evidence-based program to train. You know, so I think we could leverage a lot of that. But you know, with kids, when you think about if you have a kid and you're a parent, I mean, I think back to when my kid was 14, she had all these activities, but she was struggling, you know, and I was working full-time, and who do you talk to at 9 o'clock at night, you know, when there's just been a major blow up in the house and, you know, you aren't sure who to call, and all the offices are closed. It's not an emergency that will require us to go to the emergency room, But as a parent, being able to talk to someone, and I can remember my friends saying, it will get better, you're doing all the right stuff, you know, and my daughter now is 31 and 2 master's degrees and, you know, great mom, doing all the great things. But at 14, I wasn't sure we'd get there.
Thank you. I wasn't, and again, you're absolutely right. I'm not sure they even had a program or much with younger children, but I'm glad to know that they exist in some way, shape, or form. Maybe they can re-solidify and.
They do, and I think we should encourage that. And, you know, there is a great push now. We understand the value of people who are not degreed, who are not, you know, physicians or licensed counselors, but people who have that lived experience. We know the value, and we need to engage those people, and they want to help. But I think they should not necessarily be volunteers. I think they should be paid for the experience they bring, you know, and these should be positions, you know, they can get certification. There are even some opportunities to bill for peer parent support, you know, for peer support, and we need to recognize that value as well.
Interesting concept. How about, I remember that I think it's the state of Florida now says that if a child wants help or wants to seek help in school, they have to have parental permission to do so. Have you seen that hinder?
Yes. It's hindered in a lot of ways. We don't do school-based services in Indian River County. We do in Martin County and Okeechobee. So the opt-in, opt-out, you know, for you and I who really pay attention to everything that comes home in our child's packet and recognizes what they need, probably not a big deal. But for a lot of our marginalized families or our kids that are struggling with families that maybe aren't very supportive, that's a big deal. You know, that opt-in or opt-out. So we've been talking internally actually about whether providing school-based services is a strategy that will last over the next 3 to 5 years. I'm not sure how welcoming that environment will be. And so we need to be prepared for how we'll provide services to youth. You know, it's nice in the schools because you have access to them. You know, you don't have transportation issues. You don't have a lot of other issues. But given the current climate in the schools, I think, and, you know, I'm not trying to be political. It's just what it is. You know, it's concerning about the ability to continue to work in the schools.
Unintended consequences.
Unintended consequences, yeah.
Yep.
Anything else? Thank you very much. All right, thank you so
Ann.
much.
Thank you,
Appreciate it.
Ann. Also in their packets was Hope for Family, Senior Resource, and Substance Awareness, which were also good reports to be in there. Any unfinished business with the trustees? Any new business? Any other business?
I have a question.
Yes, other business, okay.
The legislature passed some laws, statutes that are going to require this group to get ethical training. I know that happened, but I didn't pay enough attention before about exactly how and by when and where and et cetera. Hey, I don't even know.
Can you talk in there?
A few days ago.
There are other people that need to hear you.
Thank you. Now, I was worried about a timetable that was running out. I just didn't, I don't even know why I thought about it.
It was just passed.
Okay. Thank you.
Yeah, whether it's individual or we do it as a group or all of that.
Yeah. Thanks, Jen.
Mary Beth, if I may, we are members of the Florida District, or Florida Association of Special Districts. They are going to be offering some guidance on that process as well. So I'll make sure to pass along that information to Jennifer.
Okay, great, thank you. Appreciate that.
I wanted to update the trustees. We had a meeting with William Wims from New Horizons this morning, this afternoon, just a couple hours ago. And he and his COO came, and we had a great discussion. He's going to, Greg, board chair and the medical director will be at the next New Horizons Task Force meeting and be prepared to provide the information that we have asked for.
Great.
And was welcomed and open to the partnership.
Great.
That's great news,
That's a
absolutely.
big step forward. Thank you for doing that. Public comment? Yes.
My name's Bill Stengel. I'm the chairman of the Visiting Nurse Association. And I would be grossly remiss if I didn't acknowledge the trustees' great efforts with respect to the land sale that's been proposed and approved by the district. The VNA understands that this is a resource of the community, owned, leased, or otherwise. It's an asset for the citizens, the taxpayers, the patients. Our board of 32 people understand that. I have some work to do ahead of me here shortly, but I expect that to be a very positive outcome. At the risk of throwing flowers at people, I also, over my business career, have worked with government entities and municipalities in various regards. This one is enjoyable. It's professional. It's well-led. It's thoughtful, penetrating with the questions. It's the way it should be done. And I say that without a lot of gloss. You can hear from the others in this audience that you have a successful model here. Thank you very much.
Thank you, Bill. Thank you. And we look forward to you successfully getting that approved by your board.
Me too.
It's on record, Bill, it's on record.
So we can move on. Any other public comment? If not, thank you all very much. And we'll be back together again in October. Thank you.